So I thought I'd take a couple of minutes while my little monsters are still getting out of bed just to talk around the Trainee ACP posts. Loads of interest already went out on NHS Jobs yesterday, and obviously they've been circulated on social media, which is where a lot of people have seen them. So what can I tell you about Trainee ACPs? So as you'll know if you've logged this far, advanced care practitioners are registrants who go on to do a master's programme, so you need to be nurse, paramedic are the typical backgrounds we're seeing, but also physios, anyone who's registered with HCPC or another professional body. So the registrants who go on to do a master's programme, it's a 3-year programme, and after that 3-year programme you're an independent autonomous practitioner. Certainly for the nurses and paramedics that will mean including prescribing rights. As a department we use the Royal College of Emergency Medicine ACP competencies. So the Royal College of Emergency Medicine have recognised that ACPs are the future, and we train our ACPs with those competencies. You will be signed off by, according to the RChem competencies. Pay grades, it's a band 7 during training, with obviously course fees and things paid for, and then progressing to an 8A on successful completion of the course after 3 years. We're still in our infancy with ACP, so our first cohort are just coming to the end of their 3 years. They'll graduate in September. But we are committed to ACPs as a long-term future for our workforce. We have a blended workforce model in Hull anyway. We have ACPs. We're looking at physicians associates. We have GPs. We have physios. We have med elderly teams working in the department. We have nurse practitioners. We have a blended workforce model anyway. So this is absolutely in line with that. And the ACP role brings us lots of advantages. So the RChem competencies are very thorough, is the first thing. And because we are a department with a major trauma centre, with a children's ED, because we are busy, loads of clinical exposure, loads of clinical training to a wide range of patients. And what ACPs will give us in the department is a stability and a quality bonus that we won't see with deanery FY2 posts, because those deanery posts rotate, they come into the department, they leave, whereas having a more stable workforce will allow us to deliver better care for our patients, will allow us to deliver better training experiences for all our trainees coming through, be they nursing, be they ACP, be they physician associate, be they medical. There are huge quality bonuses to having people around who know the system, know the service, know how to get things done. Training is supported by 2 consultants, so Dr. Hicks and Dr. Akoud, both very well kind of versed in this area now. As I say, our first cohort are just finishing their 3-year course. We've had a cohort every year after that, and we anticipate having a cohort most years to make sure our numbers get up to where they need to be, but also that we keep them there. Investing in the future is about long-term horizon scanning, and we want to keep recruiting because we don't want to be short on workforce. It's one of the key challenges that any emergency department has. So loads of training opportunities, really well supported. Doctors Hickson and Akoud put loads of time into the ACPs because they and we collectively as a department see you as our future. We know that we get out what we put in, so we are interested, we are engaged, we want to deliver a great training experience for our ACPs because you'll be the guys running the department in the future. Beyond the next 3 years, it's always difficult to horizon scan to know what the future looks like, but we are talking about a future with career progression. We are talking about consultant ACPs. We are talking about differing specialisms, differing roles, because we recognise that people aren't going to sit still forever, and if we don't develop our staff, then we'll lose our staff. It's difficult without a crystal ball to know exactly what that will look like, and I think one of the things we have to be honest about is if you're doing an ACP post, it is a bit of a leap of faith. Yes, I can tell you that it will be band 7 for the next 3 years. Yes, I can tell you that there will be a job at the end of that. Yes, I can tell you that ACPs are increasingly highly valued in the healthcare economy. But exactly what the future looks like, of course, as I say, I can't really tell you that. But we are committed to ACPs. I think we offer a great training package with the Royal College of Emergency Medicine competencies. I think we offer great support to our ACPs. I think it's a great place to work. Have a look. I'll put up another video about about living in Hull and kind of working in the department, the realities of that. But the trainee ACP post is a fantastic opportunity, and certainly if you're interested, get in touch. You can either ring me via hospital switchboard, or you can email me. My email is matt.story@hey.nhs.uk, so that's matt.story@hey.nhs.uk. I look forward to hearing from you. Cheers.